My name is Maggie Kettler, and I am here to share information about the American Academy of Audiology's position statement on congenital cytomegalovirus, or CMV, screening. This position statement was published in the Journal of American Academy of Audiology and is available on the Academy's Practice and Guidelines Standards website. The American Academy of Audiology recommends early identification of congenital CMV through screening to allow for appropriate early diagnosis, intervention, and monitoring for congenital, progressive, and delayed onset hearing loss in infants with congenital CMV. The purpose of this position statement is to provide evidence-based information and guidelines for the treatment of infants and children with congenital CMV. This document works to standardize the care of patients with congenital CMV. CMV is the most common congenital viral infection in the United States, impacting 1 in every 200 births, and is the most common non-genetic cause of childhood hearing loss. 1 in every 5 children born with congenital CMV will develop permanent health problems from the virus. Sadly, 400 babies die annually from complications of CMV. 90% of babies born with congenital CMV appear healthy at birth, and many times complications develop closer to 2 or 3 years of age. Due to the high incidence of CMV in our community, as well as the delayed onset of symptoms, it is critical that babies be screened by 21 days of life to determine accurate CMV status at birth. As audiologists, we are aware of the complex medical needs of patients with congenital CMV. We are also aware of the significant number of patients who do not receive timely CMV diagnosis and screening, potentially missing opportunities for early intervention and treatments when appropriate. Our role is to educate and to advocate about the importance of CMV screening and to ensure that all patients have access to the best treatment and timely interventions. I encourage you to read the full AAA position statement on cytomegalovirus screening available online.